With this model, we're observing the human eye, and this particular model is still contained within some of the orbital bones. So you have your frontal bone, your zygomatic bone. This would be your nasal bone, the most superior extension of your maxillary bone, your upper jaw. And then right here, and I'll bring this a little bit closer, right here you have your lacrimal bone, okay? And from the lacrimal bone, you have a lacrimal canal that leads into this nasal lacrimal sac and then into the nose. Now, this gland up here on the superior lateral aspect is called your lacrimal gland. This is a right eye. We know that because the lacrimal gland on either eye is on the superior lateral aspect. So your lacrimal gland releases lacrim, what we commonly call tears, but it's lacrim. It releases it onto the surface of the eye, and then when we blink our eyelid, it washes across the surface of the eye, which cleanses the eye and nourishes the cornea. The cornea is what you place a contact lens on. We'll look at that in another model. So that lacrim comes across, and it goes into these little channels called lacrimal canaliculi, and it dumps into the nasal lacrimal sac, into the lacrimal duct, and into your nose. Now, you don't notice it when it's at homeostatic rates, but when you cry, your lacrimal gland releases so much lacrim that it overflows our eyelids and runs down our face, and that's what we call tears. But these channels are capable of absorbing a lot, so you notice that when you cry, your nose also runs quite a bit, okay, which will obviously clear up when you stop crying. All right, so this is the palpebra, the eyelid. I'm going to remove this. Before I do, let me just say you have a muscle right here called the superior palpebra or palpebra superioris that actually works the eyelid. The upper eyelid allows you to raise it and close it. Okay, we'll remove this. Now what I want you to notice are the rectus muscles here. Rectus simply means straight. So not this one, that's the muscle that works the eyelid, but just underneath it you see the superior rectus muscle. And that's attached, I'm going to take it off here, but you can still see a remnant of it right here. It's attached to the superior aspect of the eye. And so when you contract that muscle, it will pull back on the superior aspect of the eye and cause the eye to look up. This muscle right here is the lateral rectus, and it's the same concept. When you contract this muscle, it will cause the eye to move towards the lateral aspect or abduct, looking away from the body to your lateral side. Let's take this one off. What you see remaining are two rectus muscles, the inferior rectus, so we can look down, the medial rectus, which will cause the eye to turn towards our nose, and then you have this, which is known as the superior oblique. It comes up and its tenon runs through a little pulley system here. The pulley is called the trochlea, and you can see it actually attaches to the posterior posterior superior lateral aspect. So when this muscle contracts, it's going to pull the eye in that direction. So consider if the globe of the eye is being pulled like this, the iris will look down and out. While we're in this view, you also see this, which is your inferior rectus, and it's attached to the posterior lateral inferior aspect of the eye, the globe of the eye. So when this muscle contracts, it'll pull the posterior lateral inferior aspect towards the medial and cause the eye to look out and up. So with these 6 muscles that we have voluntary control over, we can move the eye in any direction within the orbit, within reason. Obviously, we can't spin it around backwards, nor would we want to. All right, so now we're going to go into the eye and look at some of the internal anatomic structures. So first I'm going to take this portion off. This is your sclera. The sclera is a tough fibrous layer, so it's sometimes referred to as the fibrous tunic of the eye. It's the white of your eye. It's the outermost layer of the globe of the eye. So I'll take this off. Internal to that, you see the middle layer. Now, this is called the choroid layer. I'm going to take that right out. This is the choroid, and it's also known as the vascular tunic because you can see all the blood vessels represented here. You can also see the yellow nerves represented. But this vascular tunic or choroid layer is sandwiched between the sclera and the retina. So it provides nourishment to both. It's a pigmented layer, so it will absorb excess light, so you don't get visual echoes, right? You don't re-stimulate your cones and rods of your retina and get visual echoes. Here we see the iris, which is the color portion of our eye, and the pupil, and internal to that you can see the lens through there. But again, we'll look at these structures in another model. So I'm going to take this apart now, and if we look inside, we see the lens and the vitreous body. Now the vitreous body is the gelatinous fluid that occupies the posterior chamber of the eye, helps to maintain the shape of the eye. It's pretty viscous. Okay? If we take this out, this is the lens, and it's just represented, not that it's floating in vitreous, but that's where it resides. In fact, if we look closely here, these lines that you see here are representing the suspensory ligaments that suspend the lens within the eye. So here is your lens. It's like a little M&M. Let me get this in view. It's like a little M&M. And you have suspensory ligaments that go all the way around this. And they will pull on it when certain muscles contract and relax when other muscles contract. Now this lens has its own elastic capsule. So when the constrictor muscles contract as a result, the suspensory ligaments will relax. And because this is contained in its own elastic capsule, it will thicken. As it thickens, we can bend light more, and that allows us to see near objects. When the dilating muscles contract, they tighten on the suspensory ligaments and flatten it out, and that's for distant vision. So we all will become prey of a condition called presbyopia. That's age-related farsightedness, and that's because this capsule loses its elasticity and its ability to get thicker, and so we can't bend the light as dramatically, and we can't focus on very near objects. Finally, if we look in here, this is our retina, the internalmost layer, and this white spot that you see right here, that's where your optic nerve is coming in. So that's called your optic disc. It's also your blind spot because it's where you have no photoreceptors for vision. If we go really deep in here, we see this little yellow dot right here. This is your fovea centralis inside your macula lutea. The fovea is where you have your greatest concentration of cones for vision in bright light. Okay, so greatest concentration of cones for vision in bright light would be right here in the fovea. And that's your direct visual axis. That's directly in the posterior eye in perfect line with the center of your pupil. Okay, so we're going to look at this again. Let's move on to yet another model. Okay, in this model, we see the same eye, but none of the orbital bones exist in this model. We do see a couple of the rectus muscles, but our focus, no pun intended, our focus for this segment of the video is to look at these in a little more detail. So here's your cornea. This is what you would place a contact lens on. If we look at it in profile, you can see it right here, this clear aspect. It's actually the most anterior extension of your sclera, but the way in which the cells are arranged, it remains clear and allows the transfer of light. So from the cornea to the iris, actually the cornea to the lens, this is your anterior chamber, and this represents your lens that we looked at just a moment ago. And then this is the vitreous body. This is the fluid occupying the posterior chamber. So all of this from the lens back to the fovea is the posterior chamber, and it's filled with vitreous humor. This anterior chamber actually contains what is called aqueous humor. It's not viscous at all. It's quite watery. So it's produced by the ciliary body, which is what you see here, these pink smooth muscles. Part of that is called the ciliary body, and it produces aqueous humor, and then later gets reabsorbed in a tight, tiny little structure. You can't see it here, but it would be right at the junction of the cornea and the sclera, and it's called the venoscleral sinus or the canal of Schlemm, and it would be right there. So as vitreous humor is produced, it's also equally absorbed. If not, you develop a condition called glaucoma, in which you start to develop internal pressure within the eye. And if you just get to twice the normal pressure, it will cause failure of the eye, which is to push the optic nerve posterior, thereby disrupting all the optic neurons and your ability to see. So here again is your iris, the color portion of your eye, and this is your pupil. So I want you to appreciate the pupil is a non-structure. It is a hole. The iris controls the size of the pupil, and think of it like the shutter on a camera. When you're filming something, you always want to check the ambient light to make sure you don't overexpose your film. Well, in the case of the eye, your film is a retina. On a camera, you would set your f-stop and your aperture based on how much ambient light there is. Here, it's autonomic, meaning automatic. It's under involuntary control. We don't have to think about it. Our iris has musculature, and if there's too much ambient light, it will cause the pupil to constrict and reduce the amount of ambient light entering the eye so you don't damage your retina. When there's not very much ambient light at all, the iris will cause the pupil to dilate, get much larger, allowing more light to come in an effort to be able to see clearly and in focus. So that's what our iris does, and our pupil, again, is just an opening allowing that transference of light through the lens, through the vitreous body, and back to the fovea centralis. Here again, you can see the white of the eye, the sclera, the fibrous tunic. This is the choroid layer, the vascular tunic. And then this represents your retina, your neural tunic. This is your neural tunic. It's the innermost layer of your eye. It contains cones for vision in bright light and color vision, most of which are contained in the fovea centralis. And then around the periphery, you have rods, which are for vision in dim light. They don't provide a lot of detail, nor do they provide a lot of color. They just provide silhouettes and awareness, nothing more. And then again, here you can see your optic nerve coming out of the eye. That would be the area I showed you earlier with the optic disc or your blind spot. This would represent your fovea centralis. Now, if you're looking directly at the eye, to see anything in focus, you have to be in your direct visual axis. If you had something right here, in fact, I'll just put this probe there. If you had something right here, just off the center of your eye, you would be able to see this object, but you wouldn't be able to see it clearly. It has to be directly in your visual axis, your direct line of sight. So even just a ½ inch off center or a ¼ inch off center, you're completely aware of it, but you have no ability to see any detail of it. Okay? So this is your eye, and again, just swinging this around, you can see 3 of the rectus muscles, the superior, the medial, and the inferior. This again is a right eye. Now the way you would know that looking at this is if this is your direct visual axis, 1, the optic nerve is going to be a little bit medial and inferior to the fovea centralis. Also, you see this tendon of the superior oblique muscle that we said goes up and comes to the posterior lateral. So it's coming back here. This would be medial, this would be lateral. So that tells you you're looking at a right eye again. Okay? So that takes care of the eye. Hope you enjoyed the video.